Hello and welcome. My name is Barkha Dutt. You're watching the Mojo Story, our digital platform that has been traveling to different COVID epicenters across India, through Maharashtra, through Gujarat, through Delhi, and now we are in Ghaziabad. Ghaziabad, of course, is in Uttar Pradesh and is amongst the worst hit, very vulnerable area. But also, this is a place, and I'm just literally across the road from the cremation in the Hindon area, which has thrown up some of the most shocking, disturbing, terrifying, horrific images of bodies lined up all along on the road at the cremation site. And there have been cremations taking place in Ghaziabad through the night. You can see some of those pictures there, and we have been at that Ghaziabad cremation site where pyres have had to be burnt on the pavement because cremation sites are running short of space. We have seen these horrifying images come out of the main Ghaziabad Shamshan Ghat in Hindon, and we are at this moment broadcasting right from the road across it. We spent the day there meeting with distraught families, and at some point we're going to have to ask ourselves whether the data, the official data, is really revealing the full extent of the carnage that COVID is unleashing on our country. So like I said, we are a small team of journalists who travel to all the COVID epicenters. We continue to be on the ground, tracking what's happening inside ICUs, at COVID cremation sites, at graveyards. And as more and more states seem to panic and enter some version of the lockdown or the other, though the lockdown word is not being used, we're also seeing some repeats of last year. Now, Delhi, for example, the capital, announced a 6-day lockdown, and it was almost as if history repeated itself. Here's what happened late at night at the main bus terminal in the capital city. We saw hundreds, if not thousands, look at those pictures, of migrant workers, even though there was a finite time that was placed on that lockdown. You saw the poorest of our country leaving the cities again. This has happened in Mumbai as well. It's not just happening in Delhi. And the fact of the matter is that we spoke to many of them and we tried to understand why they are going. And all of them said the same thing. They do not actually believe that the lockdown will be for only 6 days. So whether it is Ghaziabad, where we are right now, or whether it is Delhi, where the lockdown has been imposed, or whether it is Rajasthan, where restrictions have been imposed, or whether it is Mumbai, and everyone's avoiding the word lockdown, we are confronted with this question. Vaccines have been rolled out. Vaccine regime has been opened up from the 1st of May. If you're above 18, you can get a vaccine. Now it's been left to the states. Earlier, the center was deciding which state should get which vaccine. But at the moment, because we don't know if there'll be enough vaccines, we're still in the phase of lockdowns. Now, what we want to ask today is, had we unlocked vaccines earlier, would lockdowns be necessary? As many of you know, personally, I've been ferociously against lockdowns. And I'm going to play out for you in a moment from now our ground report on meeting those migrant workers. But first, I just want to get a first set of responses from our expert panel today. And if we can bring up their names, I'd just like to introduce all of them one by one. We're joined on the program by Dr. Ambrish Mittal, who's been at the front line of the COVID battle. Welcome to the program, sir. Dr. Swapneil Parikh joining us from Mumbai. He and I have been arguing literally for months over the efficacy of lockdowns. And he is having an I told you so moment with me. And I want to tell him I'm still not convinced, but I want to understand more from him why he thinks lockdowns are so necessary. Dr. Arvinder Soin, another COVID warrior, joining us. And Dr. Soin has been vaccinated fully and has tested positive twice for COVID. An outlier story for sure. And I do not want to create panic. It does not mean that vaccines don't work. That's one of the reasons that Arvinder is actually looking pretty good. And we'll hear from him about that. And finally, we have two of our policy analysts on the program, Dr. Shruti Rajagopalan from the George Mason University, joining us from the United States today, and her co-author on a very important paper on lockdowns, Abishek Choutagunta, who's joining us from the University of Hamburg. Both of them have co-authored a paper researching whether lockdowns work or not. And I want to get a set of first comments, and then I'll play out a quick report from you. And Ambrish, I'll start with you, because You have been, like me, anti-lockdowns, but you came around to the fact that at least the capital, maybe no national lockdown, but the capital needed one. What made you change your mind, Dr. Mittal? And you're muted at your side, so just unmute yourself and speak.
Yeah. So, lockdowns obviously have a lot of repercussions, and I think we're going to go through all those as we go along. And obviously, they are not pleasant, and a certain section of society, but almost all of society takes a big beating. But the truth is, when the healthcare system is completely overwhelmed, from morning till night, I'm answering calls, trying to arrange beds for somebody, oxygen for somebody, something else. So I think the system is cracking, even in the capital. So when that happens, whatever vaccination you might do, whatever else you might do, unless you put a sudden stop to physical interaction of people so that at least the spread goes down temporarily as a temporary measure, I don't think that you can get around this. So at the moment, we had reached a situation when there was no option but to announce a curfew or lockdown or whatever you will. So the healthcare system is just creaking because there are just too many people. There are just too many people getting affected by COVID who require admission.
But Dr. Mittal, the question could be asked, what will happen when the lockdown opens? There's now talk of a triple mutant. There was talk earlier of a double mutant. Now we're talking about a triple mutant. This virus could be around for years. The lockdown was only meant to give breathing space to health systems to get their act together. Everybody said a second wave was coming. It could be argued that the health system should have been better prepared instead of shutting down cities, shutting down countries, because the simple question is, how often are you going to do it? It's a little bit like starving yourself to lose weight. The moment you start eating again, the weight is going to come back and there are going to be complicated other health issues. I know I'm giving a very superficial example, but just to make it accessible to the larger public, I'm using a very simple example. Dr. Mittal.
You're right. I mean, we should have been better prepared. But the truth is that the magnitude of the second wave, firstly, I don't know if we were well prepared for a second wave anyway, but the magnitude of the second wave has really sort of taken everyone by surprise. The fact that we are seeing far more cases than we were, you can see how the curve is going up, and all this talk about the cases being milder this time and having less complications is also taking a beating, because we are finding a lot of serious cases, especially even among younger people. And with all the mutants and all coming in, I think at the moment we really did not have a choice. Now the time for us is to really not make the same mistake again. There could very well be a third wave or a fourth wave after this one settles. So we have to be on guard all the time. We should not remove the facilities as quickly as we put them up. See, there is pressure on the system because the non-COVID are suffering. So moment you increase a high proportion of beds for COVID, then what happens to the non-COVID? The moment you remove COVID beds, they fill up. So this time it's also taken longer because the beds were full with non-COVID patients. You can't throw them out. So it's a challenge, I agree, but intermittent lockdowns, I feel, will have to be done seeing the way it's gone. And I don't see the Indian healthcare system, which is, of course, I think actually responded very well to the pandemic, because I know the baseline of our healthcare system. You have to think outside metros, Barkha, and you travel everywhere more than anybody else. So the level of delivery of our healthcare system obviously is seriously challenged. And if you throw a whole lot of COVID on it, which is just engulfing the world, it is going to be a challenge. It's not going to be easy for us to say, why didn't we ramp up facilities? It's not so easy. I mean, remember, March last year, there was one lab doing an RT-PCR test. Now there are 2,500 labs doing an RT-PCR test. Yet now, in this second wave, we are having to wait 3-4 days for a report. So it's the wave is overwhelming.
That was one of the reports I did, that I'm not very convinced about our data, because there are such huge gaps between the time we are testing and the time we are getting the results, that when we are measuring plateaus and peaks, we don't actually have a tactile real-time set of numbers, and some laboratories are not even collecting samples, and you're having to use, if you're a privileged like us, influence even to just get a test. When I say influence, call up a doctor friend. I mean, that's the extent. Test karwa do, and even they can't do very much. That's how burdened the system is. Arvinder, tell us a little bit first about yourself before I ask you what you think about lockdowns. Because, the ill-informed, and that's my problem. There isn't enough science out there. We need a lot more science out there. The ill-informed are going to look at you and say, Doctor Saab, aapko to 2 baar hi ho gaya, vaccine ka fayda kya hai, hum nahi lenge. या ले भी लें तो कोई फायदा नहीं है. And I've, before I ask you your opinion as an expert, I want you to talk as someone who's tested positive for COVID twice. Despite being fully vaccinated, please explain in accessible language that a vaccine protects you against hospitalization and mortality, not against the getting in the infection per se. So that distinction between infection and disease in your own story. Please go ahead.
Yes, Barkha, I had the first bout of infection last year, about 9 months ago. And then I had complete vaccination. I had the 2 doses. The second dose was about a month ago. And now I've tested positive again. Now, let's be very clear. The vaccines will prevent severe disease and death. I mean, fingers crossed. And as you can see, I'm pretty okay with testing positive the second time around. I just have some mild sore throat and a bit of a snuffle. But otherwise, I'm quite okay. So what the vaccine has done, not just to me, but a lot of healthcare professionals who've had their vaccination 2 doses and yet acquired the infection again, and we've read about those in the newspapers and online so often in the last 2 weeks, is that they have all the vaccinated people have had only mild infection. So vaccines have prevented severe disease and death. And in that sense, they do help break the transmission, because once somebody has mild infection, they're not that infectious compared to people who have severe infection. Of course, they also don't, crowd up hospitals. So vaccines do work. Please, people who are eligible to take the vaccines, do take them. And there was this question that you asked earlier about whether if we had instituted the open vaccination policy earlier, could we have avoided lockdowns, etc.
Yeah.
Do you know that only 8% of India's population has had 1 or 2 doses? And perhaps just about 2% have had both doses. So even if we had vaccinated double or triple the number of people, we would have still been reeling under the second wave, and possibly there may be a third wave. I mean, US and UK had their second wave in Jan-Feb. It's only just about subsiding. It was inevitable that it was going to happen to India. So I think that, like Ambrish said, when the numbers get overwhelming, when we are flooded with patients, both COVID and non-COVID, in all our hospitals, there is just no option except to prevent physical contact of people. Of course, we could also say that we have not been, exhibiting responsible COVID-appropriate behavior. That is also true. But even then, otherwise, non-essential crowding should be absolutely avoided, and lockdowns do essentially that. So I think that I'm not fond of a lockdown. Nobody is, but it's just inevitable. We don't have an option, really. But it should be short lockdowns. It should be like 10, 15 days, not more. And we should just really not paralyze economic activity for any longer.
Tell me this, you are saying, Arvinder, that even had the vaccine rollout been faster, we would have needed a lockdown?
Yes, that's exactly what I'm saying, because the percentage of population that you're covering in India is pretty minuscule compared to what the West has done. I mean, even with this kind of vaccination rate, which is approximately 25, 30 lakh people a day for the last probably 2-3 months now, we've only just reached about 13 crore vaccinations. And I've already given you the figures. So probably even if we had vaccinated twice or thrice the number of people, we would have still had to deal with the second wave. And considering the size of the country, 3 lakh cases a day is just only to be expected. And if you want to stem the tide, then I guess a short lockdown is all you can do.
So both the doctors thus far have been in favor of lockdowns, and I just want
not exactly the same thing. I think we are basically forced to do it. That's all.
But what could have prevented it? What, if anything, could have prevented it? I mean, the lockdowns are meant to be for the health system, not for the virus.
Yes,
the lockdowns don't punish the virus. The lockdowns punish the poor. That's my problem with lockdowns.
Yeah. So theoretically, if 50% of the people had either got the COVID infection or vaccinated, and if we had all exhibited more responsible behavior, perhaps the huge second wave or the huge second surge and the consequent need for lockdowns could have been prevented, perhaps.
Okay, so lots of perhaps there. Swapnil, very quickly your response, and then I want to play out my report with the migrant workers who are leaving the cities in the thousands. Swapnil, you've been arguing for a quicker, earlier, harder lockdown, unlike Ambrish and Arvinder, who kind of feel like there was no other choice. I'm not saying you're a fan of lockdowns, but I'm saying you've been asking for it much earlier than literally anybody else. Why was that? Can you unmute yourself? Swapnil, you're on mute. Please unmute yourself. Yeah.
I don't think anybody is a fan of lockdowns. I mean, when we look at data and we see what's happening, even if I'm not a fan of a lockdown, when I see cases rising the way they are, the speed of the increase in areas that had a sizable number of people already previously infected, at that time it becomes kind of clear what's coming. Now, I will push back very strongly against saying that this was definitely going to happen to India. No, I mean, we have to divide our interventions into pharmaceutical interventions and non-pharmaceutical interventions. So if your question is, could we have out-vaccinated this and allowed election rallies, allowed mass gatherings for religious events and everything else that we did wrong?
No, I'm not. Of course, that's not my question. I'm totally against the rallies and the mass congregations.
I'm clarifying that you need to do both. So if we had followed the non-pharmaceutical interventions, not to as rigorous a degree, but also had a much faster rate of vaccinations, then both the NPIs plus the vaccination together reduce the R, the reproductive number, and would have prevented the peak that we are experiencing now.
Yeah, but can I quickly just ask you one thing? Of course, the rallies should never have happened. And by the way, they're still not called off, despite the fact that the Chief Election Commissioner and an election commissioner have tested positive. We have now Rahul Gandhi testing positive. We have a Minister of State in the Prime Minister's office, Jitendra Singh, testing positive. None of it seems to matter. I don't know what these politicians are thinking, what the constitutional functionaries are thinking. But Swapnil, had we not dismantled our jumbo facilities, had we not taken COVID treatment back into hospitals, right? Had we kept these jumbo facilities where COVID should be treated, I think this is the fatal mistake we make again and again. We have forgotten in this country that 3,000 people die from tuberculosis every single day. 3,000 people die from cancer every single day. Where are these people going to go right now?
No, but that's not the
created a
fatal
health
mistake we made.
crisis.
The fatal mistake we made was thinking that this was over, that the worst was past us. This was a consequence of that mistake. Let me just say this, no matter how much you scale your healthcare system, we could have scaled it even more. We were given a pittance of the resources we needed. No matter how much you scale your healthcare system, that's called raising the line of the healthcare system to respond. Exponential growth will always breach that line. So you need to do both. You need to scale the response of the healthcare system. You also need to flatten the curve. You need to do both. They work hand in hand. You can't just scale the healthcare system and then say that let infections run rampant. It won't work.
Okay, what I want to do is now, I want to go to Shruti and Abhishek. I also want to get the doctors to weigh in on what I'm just going to show you. So I went to the main bus terminal in the capital, and I tried to talk to these workers about why they're leaving. I kept saying to them, 6 din hai, it's only 6 days. Can't you just wait? And just listen to what they said, and then we need to evaluate how long we can carry on doing this to our poorest citizens. History is repeating itself here at the main bus terminal in the national capital. After the 6-day lockdown has been announced, you can see all behind me, and in fact, even beyond these people, a line of buses and migrant workers, daily wage workers, people who are insecure about their future are leaving. The saving grace, of course, is that this time they are not walking hundreds of thousands of kilometers, which was the defining image that we reported at Mojo Story in 2020. But why are they leaving in 2021? आइए इनसे समझते हैं. सर, आपका नाम?
प्रदीप कुमार मैम.
प्रदीप जी, आप क्या काम करते हैं?
एसी मैकेनिक है मैम.
अच्छा, तो आप कहाँ जा रहे हैं?
बनारस में.
और क्यों छोड़ के जा रहे हैं?
मैम, 1 हफ्ते का लॉकडाउन है, अब यहाँ रह के करेंगे क्या बैठे बैठे?
तो आप 1 हफ्ते में वापस आ जाएंगे?
नहीं मैम, अब जब तक पूरा सही नहीं होगा तब तक कहाँ से आएंगे?
तो 1 हफ्ता तो कोई इतनी लंबी टाइम नहीं है, वेट क्यों नहीं किए?
नहीं मैम, फिर भी हमकी काफ़ी टाइम हो गया, तो हमकी छुट्टी भी कर लेंगे. इस 1 हफ्ते के लॉकडाउन में यहाँ बैठ के कोई मतलब तो है नहीं. कहाँ से आएगा? सब कुछ राशन पता ही सब कुछ. तो
मतलब आपको ऐसा लग रहा है 1 हफ्ते से ज़्यादा हो सकता है?
बिल्कुल हो सकता है मैम.
अच्छा, तो यहाँ पे काम अभी चल रहा था आपका?
हाँ मैम, अभी तो काफी अच्छा काम चल रहा
तो
है।
फिर क्यों छोड़ के जा रहे हो?
अब लॉकडाउन लगेगा, काम होगा नहीं मैम, तो क्या करेंगे यहाँ?
आपको लगता है बिल्कुल काम रुक जाएगा?
जी, बिल्कुल
और
रुक
आपको लगता है 5-6 दिन, आप
बिल्कुल।
5-6 दिन से ज्यादा चलेगा?
जी बिल्कुल चलेगा।
क्यों ऐसा लग रहा है?
लग रहा है मैम ऐसा है।
क्योंकि आपसे पूछती हूँ। हाँ, आप बताओ सर।
पिछली बार भी तो ऐसे हुआ था।
आप अपना नाम बताइए।
नंद
सर।
किशोर।
नंद किशोर भाई, आप क्या करते हैं?
ये बेलदारी।
अच्छा, तो क्यों कहाँ जा रहे हैं?
गोरखपुर।
गोरखपुर। क्यों छोड़ के जा रहे हैं?
क्या काम धंधा है नहीं यहाँ पे?
आप कहे कि आप नहीं मानते कि सिर्फ 6 दिन का लॉकडाउन होगा?
नहीं मानते जी।
क्यों नहीं मानते, बताओ।
पिछले साल भी ऐसे धीरे धीरे बढ़ गया था, 3 महीना कर दिया था, 1-2 दिन के लगाया था, फिर 3 दिन का बढ़ते चला गया था। इस बार भी ऐसे होगा।
पर इस बारी अगर आप देखेंगे,
विश्वास खत्म हो गया ना।
हाँ,
विश्वास खत्म हो गया गवर्नमेंट का।
इन्होंने जो कहा शायद वही सबसे बड़ी बात है। इन्होंने कहा हमारा विश्वास खत्म हो गया है, जिसको अंग्रेजी में कहते हैं ट्रस्ट डेफिसिट, या ट्रस्ट जब टूट जाता है। इसके बारे में जरा बात करिए कि विश्वास आपका क्यों खत्म हो गया?
पिछली बार देख के विश्वास खत्म हो गया। पैदल गए थे पिछली बार हम।
आप पैदल गए थे?
पैदल गए थे, पिछले बच्चों को ले गए।
मैंने बहुत लोग देखे पैदल। आप यहाँ से गोरखपुर पैदल
गए थे, पैदल गए थे।
तो 1000 किलोमीटर से भी ज्यादा हुआ वो तो।
कई जगह हमने रात को आराम किया, फिर चले, फिर आराम किया, चले। कई जगह रास्ते में खाना मिला नहीं मिला, ऐसे भूखे गए हमारे बच्चे।
तो अभी आपका परिवार कहाँ है?
परिवार तो मैंने भेज दिया परसों।
आपने भेज दिया?
हाँ।
और आप कह रहे हैं क्योंकि आप पिछले साल पैदल गए, नंद किशोर भाई,
हाँ।
तो अब आपको विश्वास नहीं है और आपको लगता है कि जब बसें चल रही हैं तो
हम भी निकल जाएं।
पर गांव जाके क्या करेंगे भैया?
क्या करेंगे
भैया? गांव जाके
कोई ना कोई काम करेंगे, क्या करें? वहाँ ये तो है कुछ ना कुछ काम मिल जाएगा हमारे को।
अच्छा, वापस आएंगे?
पक्का नहीं कह सकते।
अच्छा, एक बात बताइए, आपने कहा विश्वास टूट गया, लेकिन इस बारी आप देखेंगे तो कुछ चीजें अलग हुई हैं। जैसे कि पिछली बारी पब्लिक ट्रांसपोर्ट बंद हो गया था, इस बारी बसें ट्रेनें चल रही हैं, उस तरह का कड़क लॉकडाउन नहीं लगा है।
नहीं, इस बार नहीं है।
तो
इस बार
फिर
तो
आपको
ये
क्यों
सुविधा
विश्वास
है,
नहीं
ये
है?
सुविधा है।
तो फिर विश्वास क्यों
ऐसा है ना, शायद पब्लिक को निकालने के चक्कर में कर दिया ये, फिर बाद में एकदम क्लोज कर दें, फिर क्या करेंगे हम?
मतलब आप ट्रस्ट नहीं कर पा रहे। अच्छा, ये है नंद किशोर भाई। अगर मैं इनके बारे में बताऊं आपको, तो ये कहते हैं पिछले साल ये पैदल चल के गए थे। अपने बच्चे भी थे?
बच्चे भी साथ।
कितने छोटे थे बच्चे?
बच्चे मेरे छोटे थे, 10 साल का था, एक 15 साल की लड़की है।
तो ये है उन हजारों भी क्या, देवर मिलियंस ऑफ सच पीपल जो पैदल चल के अपने घरों लौटे, और अब इनको विश्वास नहीं होता कि दोबारा वो ना हो जाए, वही हालात ना हो जाए, तो ये जा रहे हैं गोरखपुर। और आप में से बताइए। हाँ,
पीली खिचड़ी आती थी।
हाँ जी।
जो लेने जाता था पीली खिचड़ी ना तेल आए ना उसमें हल्दी मिली हुई आती थी।
पिछले साल?
पिछले साल मैं तो यहीं रहता दो महीने के लिए लॉकडाउन में, तो पीली खिचड़ी आती थी। वो कहते थे ले जाओ, 10 मिनट रुकते थे, भाग जाते थे। केजरीवाल कहते ये दे रहा हूँ, वो दे रहा हूँ, वो दे। राशन के अलावा कुछ नहीं मिला था। कोई कहता था कि आधार कार्ड लिए जाओ, राशन मिल जाएगा, राशन नहीं मिलता।
आपका नाम क्या भैया?
हमारा राम सागर नाम है।
क्या करते हैं?
हम फ्रूट का काम करते हैं।
मतलब फल बेचते हैं?
हाँ जी।
तो कहाँ जा रहे हैं?
अब मैं गाँव जा रहा हूँ।
गाँव कहाँ है?
शाहजहानपुर।
तो क्यों जा रहे हैं?
इसी चक्कर में जा रहा है कि पहले ही कर्जा लेके खा लिया था।
कितना कर्जा लिया आप?
मैंने 1.5 लाख रुपए कर्जा लेके खा लिया था।
1.5 लाख कर्जा लिया?
हाँ।
पिछले साल में?
हाँ जी।
अब वो कर्जा आप चुका पाए हैं?
नहीं चुका पाए और ले लिया कल 22,000।
किसने लिया?
मैंने।
क्यों लिया?
इसीलिए गाँव जाने के चक्कर में लिया है।
बस की टिकट कितनी है?
तो 509 रुपए की।
अच्छा, तो 22,000 क्यों लिया आपने कर्जा?
22,000 इसलिए लिए है कि वहाँ कर्जा हो गया। ये 6 महीने से काम ही नहीं चल रहा है। किराया मकान मालिक मांग रहा है, किराया दो, बत्ती का बिल दो, कहाँ से लाऊं? तब कर्जा लेकर तुम रिश्तेदारों से लेकर के मैं उनको किराया दे करके आया हूँ। 6,000 एक मकान मालिक रह भी गए हैं, 1 महीने का किराया छोड़ा है मात्र। क्या बताओ?
आप बताओ, मकान मालिक के साथ क्या हो रहा है, बताइए।
मकान मालिक कमरा लेने जाओ 4,000 5,000। अरे बाबूजी कम लगा लो, लॉकडाउन चल रहा है। नहीं लेना ले लो, नहीं रोड पे रहूँ, बताओ लेना पड़ेगा। कर्जा लो, चाहे बच्चे में दो, चाहे भूखे मरो। बोलो।
आओ थोड़ा आगे हम आपकी कहानी सुनना चाहते हैं, क्योंकि मैं देख रही हूँ आपकी आंखों में भी आंसू भर आए हैं। तो
जब आदमी परेशान हो जाता है तो आंखों में आंसू आ ही जाते हैं। जब बंदा परेशान हो जाता है रो रो के ही गुजारा करता है। क्या जाने गरीबी का हाल है। लोग गरीब का हाल कोई नहीं जानता है। गरीबी का हाल गरीबी जानता है। गरीबी गरीब की मदद करता है, बड़ा आदमी कोई गरीब की मदद नहीं करता है। अब करता हो तो वो आज हमको हकीकत दिखा के दिखा दे, जमीन की हकीकत दिखा के दिखा दे। ऐसे क्या चैनलों पे हम भी बोल देंगे, अभी बताओ कुछ भी बोल दें। हम पे 20 लाख रुपए है, हमारे खाते में देखो वहाँ 2 रुपए नहीं है। ऐसे बोलने को क्या, बोलने तो कुछ भी बोलते हैं लोग, मंत्री संतरी कुछ भी बोलते हैं।
एक मिनट, आपके आंसू देख के मुझे बहुत दर्द हो रहा है। आप लोगों को
1 साल हो गया दर्द होते हुए, 1 साल हो गया दर्द होते हुए। अब किसको सुनाऊं? आप भी सुन के चले जाओगे, बस बात खत्म हो जाएगी मेरी। हमारा तो यहीं तक
ये हमें भी याद दिला रहे हैं कि पत्रकार होते के नाते भी हम भी आते हैं।
हमने कई मीडिया बिकते हुए देखी हैं। हम टीवी देखता हूँ, मैं जानता हूँ कौन सी मीडिया बिकी है, कौन सी नहीं बिकती है। सारी मीडिया बिकी चुकी है।
मीडिया से भी नाराजगी है, लेकिन
नाराज है तो हकीकत है ही नहीं। जमीनी हकीकत कोई दिखाता ही नहीं है। जमीनी हकीकत कोई नहीं दिखाता है। ये सारे बंदे इतने मेरे भाई बंदे हैं, बताइए इन पे परेशानी नहीं है, क्यों जा रहे हैं? इनको क्या दिक्कत है? जो यहाँ कमाने आए हैं, या कोई भागने नहीं आए भागे। इनके बाप का ये दिल्ली नहीं है किसी का।
सही बात।
कमाने आते हैं, गरीब आदमी है। इनके पास ना तो खेती होगी, ना इनके पास कुछ भी होगा।
There's a lot more there, but I think you got the general sense of rage. ये बाप की दिल्ली नहीं है, ये नेता क्या समझते हैं, गरीब आदमी की कोई देखभाल नहीं करता, ये मीडिया बिकी हुई है. I wanted to keep it till the point when he lashed out at my fraternity, because there's a lot of anger with the media as well. And I want to come to Shruti and Abishek in just a second, but Arvinder, if you just want to come in, I know you had a thought on the larger debate around lockdowns. Go ahead. Yeah.
I mean, I think that all I wanted to say was that lockdowns obviously hurt everyone, and they hurt the poor disproportionately, as you said on your show a little while ago. But what is the option of not having people crowd up in workplaces or in streets or in any situation in life? I mean, of course, now in the situation where there are frontline workers, as in hospitals or police or army or any of the other essential services, that's unavoidable. But other crowds, you have to do away with. And when you do away with the crowds, then what's going to happen is that the laborers, they want to just go home because they feel insecure, and they want to go home, and then they crowd up the buses and the trains, and some of them walk back, and we saw that last year. So it's really the devil in the deep blue sea, really. There's very difficult to decide whether it's actually going to work, if it's going to be beneficial or not. But overall, I think it'll still prevent crowding up, as we want to avoid it for at least some time. And I don't think every migrant worker will go back. Some of them will, but some of them will probably stay.
Yeah, I'm not sure we're going to see the scale of what we saw in 2020, and that's a reasonable point. But that's only if lockdowns remain finite and short. And right now, what they're not believing that the lockdown will be short and finite, and that's the point. Shruti and Abhishek, if I can bring you in, for me, the moral problem is lockdown for citizens, but election rallies carry on. Mercifully, now the Kumbh has become symbolic. The Thrissur Poonam in Kerala, which was going to go on, has become symbolic. But that's almost at the fag end of this election. Now, I know that your study, and we'll bring up the main points of it in a moment, you spoke about the dysfunctional federalism in India, both you and Abhishek. You spoke about how there's a variation across states, a variation between urban and rural. No one-size-fits-all policy can work for India when it comes to combating COVID, and that includes lockdown. So go ahead with what the key learning has been, that we should not make those mistakes all over again in 2021. Shruti.
Thanks, Barkha. And, as all three of the doctors said, especially Dr. Mittal, nobody wants a lockdown. But the truth of it is that our healthcare capacity is completely overwhelmed. So the success or failure of any lockdown is dependent on the healthcare capacity and the transmission rates. If one has excellent healthcare capacity, any lockdown is either unnecessary or a failure, because there's a huge imposition of economic costs, especially on the poor. But I don't just want to make this about the poor, because if the healthcare capacity is weak, then a lockdown, no matter harsh, can also help save lives, especially of the poor, because we know that in this country, when hospitals are overwhelmed, the poor are also the first to be left out of the healthcare system, and they will also be the ones who are dying. So I just want to flag that up front. Now, what have we learned about lockdowns from the previous lockdown? I just want to give the big picture, and maybe Abhishek can jump in and give us the details on variation between states. A centralized one-size-fits-all lockdown, we've learned, is a really bad idea. And we say that for three reasons. Number one, there are very few states where it was even a partial or a complete success. And what I mean by that is, there were a few states like, say, Maharashtra, Karnataka, Tamil Nadu, West Bengal, Telangana, even Delhi, where having the lockdown slowed down the transmission, reduced the number of cases, and staggered them. And as the lockdown started getting lifted, once again, transmission lifted because mobility rates lifted. But there are other states, really large states, including, Uttar Pradesh, Bihar, Madhya Pradesh, for instance, where a simple border control and tracing, contact tracing and quarantining would have worked much better, because local transmission, and this is, last year, April, local transmission was relatively low in these places. So having a lockdown dramatically reduces mobility, right? It dramatically reduces economic activity. It imposes costs on poorer states, but it was unnecessary because these states didn't have massive amount of an outbreak in the first place. And finally, in places like the Northeast, especially like Sikkim and Mizoram, which literally had zero COVID cases when the lockdown was imposed, it was just, completely unnecessary. These are remote areas. They were particularly punished, right?
So am I hearing you saying that any lockdown has to be a localized decision and not a centralized
Absolutely.
one? Would that be the
Absolutely.
big takeaway of
Yes.
your finding?
So
Yeah.
the first takeaway of our study, and this is a study done by Abishek Choutagunta, myself, and GP Manish, who's at Troy University, is that a centralized one-size-fits-all lockdown is a very bad idea, for the simple reason that a lockdown success depends on healthcare capacity and on transmission. And both these parts, that is the transmission of the outbreak and the healthcare capacity, widely vary across states. In fact, also widely vary within states between urban and rural areas sometimes. That's part one of the story. Part two of the story, I think Abhishek can inform us really well on the exact variation in the states and how our federalism really operates.
Okay, Abhishek, you called it dysfunctional federalism, and the reason I want everybody to pay attention to what you're going to say next is I want to Swapneil and Ambrish to talk specifically about how it's going to work, leaving the states to themselves to arrange the vaccines, which is what's going to happen now. The states have been told you can go and buy vaccines directly from vaccine manufacturers. Now, the question is, we have gone completely from the center dictating the lockdown, dictating the vaccine distribution, to leaving the states to fend for themselves. So your observations, Abhishek.
Yeah, so I think first of all we have to understand that there's a strong relationship between how rich a state is and how their healthcare capacity is. States like Bihar and Uttar Pradesh, which have very low per capita incomes, have some of the least healthcare capacity, and they also budget very little amounts of money to healthcare. So like I think Bihar and Uttar Pradesh dedicate like 4 to 5% of their state GDPs for healthcare, whereas Andhra Pradesh and Tamil Nadu would have more. And this then shows up in the number of doctors, doctors which there are per 100,000 population in a state. Like you see, Andhra Pradesh and Tamil Nadu have somewhere close to 150 to 200 doctors per 100,000 population, 1 lakh people, and Uttar Pradesh and Bihar might have less than 50. So there's like this one third the number of doctors per capita for a double of the population in terms of density. So when you see that there is a huge amount of variation, states need to be given some control over how they manage the virus. If you don't really let the states decide, because the central government will not know the ground realities in the best possible manner, the state governments will. And if they don't take action, it's just going to be that Sikkim, which probably has no cases at all, will have a centralized lockdown and curbing all mobility, all economic activity, and you'll have a complete mess. This is the first thing. And then the second thing one needs to understand is that this huge amount of differences between how people move in urban areas versus rural areas. And when you cut down mobility in rural areas, they cannot go to places to buy essentials. And that really leads to a lot of... there have been surveys which have said that it's the poorest households cannot survive for more than 2 to 3 weeks in some of the rural places in India, which during the time of the lockdown, exactly the last year. So when you cut mobility across the place and impose centralized lockdowns, it's going to lead to problems like that.
So here's what I want to ask the doctors, to Swapneil and Ambrish. The number of people, are we not counting, or are we disregarding the fact that so many people believe that the poverty will claim their lives well before the virus will? And that is a huge problem with lockdowns. That's question one. Question two, Shruti and Abhishek's study talks about federalism and how there was an over-centralization. And now we've gone completely the other way with the vaccine rollout. We've told the states, go buy your vaccines. Go buy them from wherever you want to buy them. So some states are richer than others. So I'm really confused. We've kind of lurched between two extremes here. So first, just on the point of lockdowns, I think we all agree that centralized lockdowns don't work, which is what Shruti and Abhishek's study bears out. Swapneil, you want to come in quickly on that? Would you at any point say a national lockdown all over again?
I think we need to differentiate very clearly between a centralized lockdown and a national lockdown. A lockdown can be imposed by the center on certain parts of the country, depending on what they are seeing in their data source, excluding other parts of the country, and not have a blanket national lockdown. I think that makes a lot of sense. If there are areas that aren't seeing the healthcare system being overwhelmed, it is actually in our interest to keep those areas open, to have them contribute higher to maybe oxygen output, production of medicines. That makes sense. But what we have to keep in mind is right now across the board, most areas of India are showing very, very high growth. And if their hospital systems aren't overwhelmed already, they're going to be very soon. So I think, of course, we have to be sensible about which areas we impose a lockdown on. We can't.
But how are we being sensible when, Swapneil, and I want Dr. Mittal to come in on this as well. In Tamil Nadu, for example, I was reading that parks and beaches have been closed, but restaurants are open. I mean, we are not even doing the science right. We are not explaining to people, because we are still stuck in the stay-at-home mentality of the 2020 lockdown, that open spaces, provided they're not mass congregations, are way safer than being indoors with 20 other people.
I completely.
Swapneil, one line, and then
I completely agree with you that we need to do the science correctly. But I think we can't use the incorrect science or the things we've done wrong to say that lockdowns don't work. I'm on board with you that we need to be sensible about the non-pharmaceutical interventions we deploy. We can't say that just because certain people in policy have taken it to the extreme, done it the incorrect way, that the policy itself is flawed. It's not. To your point about which areas we lock down, you have to also keep in mind, if you're going to do selective lockdowns, then you need tight borders between the areas that are locked down and the areas that aren't. So you need to be able to do that. You can have free movement in one area that doesn't have a lockdown going on, but you have people shifting, like let's say Maharashtra is locked down, and there's
but how long? My question still remains: how long are we going to keep doing this? How long are we going to keep doing this? Ambrish, I want to ask you.
Keep doing it forever, but that's not an accurate statement to make, that we're going to keep doing it forever. We're not.
I'm asking
we shouldn't be doing it forever. It represents a catastrophic failure that we're having to do it a second time. And that's what I've been pointing out from the earliest parts, that this is the last resort, most blunt tool. Everything in pandemic response should be geared towards preventing us to get here. But once you get to this point, you're boxed into a place where you don't have other options. It's a catastrophic failure that we're here.
Yeah.
Okay, Ambrish, what made... sorry, Shruti, you want to come in with one sentence? And then I'll go to Ambrish.
I just, want to say that I think we focus too much on lockdowns, probably because of the horror of what unfolded last year. I still haven't heard too many people in the leadership, right, whether it is state or the union government, come out and talk about non-pharmaceutical interventions, right? Come out and talk about social distancing, masking, testing, scaling up testing and contact tracing, quarantining in, jumbo centers, or even lots of hotels and places like that many state governments had these pop-up quarantine centers. These are things we've gone over once before. This should be the focus, right? Eliminating super spreader events. So this idea that we have a lockdown or nothing, and are we for or against lockdowns? I think it's a binary which has really clouded the policy debate. I think the real question is, it is still not too late. We're a very large country. We need healthcare capacity, not just for this pandemic. We need it for the future, for the well-being of all Indians. So focus on increasing healthcare capacity very, very, very swiftly, both at the union and the state level. And second, as many non-pharmaceutical interventions as possible, alongside scaling up, vaccine production, which obviously cannot happen overnight. So, but the conversation of correct usage of, masks, washing hands, maintaining 6 feet distance, only congregating in like open spaces, not congregating in large numbers, this is really what we should be talking about, as opposed to saying a lockdown. Because, as all of you mentioned, the lockdown is really the last resort. When we are having this conversation, we're at a point where it's either a lockdown or a complete collapse of our healthcare system, and that also really hurts the poor. So, there's not too
Yeah.
much choice at this point. If you ask us, none of us are for a lockdown, and none of us think it's avoidable, or at least a
Yeah.
local curfew
I
is the
get that.
capital.
I get
To
that.
one
Dr. Mittal,
point, Wuhan did
can I
just
just
one
get...
lockdown.
Sorry? Sorry?
Wuhan did just one lockdown. It's not an
Yeah.
endless cycle.
But
Yeah.
we have no idea what's actually happening in China. It's like the vaccine, right? Like we just don't know enough. There's just an absence of transparency there. I'd be hesitant. But on the other hand, you have Europe in an endless kind of a cycle of lockdowns, of night curfews. We laugh a lot at our night curfews, but I was talking to Abishek in Hamburg, who was saying in Germany every night there's a curfew, and like, so maybe people are kind of just helpless and hitting out in all directions. But Dr. Mittal, I will still ask, how long can the world carry on like this? I mean, at some point, do you agree with what the other panelists said, that even had we vaccinated quicker, faster, had we approved foreign-made vaccines quicker, we would still be in this situation? Can we unmute Dr. Mittal, please? Yeah.
So we could have reduced the magnitude, I suppose, definitely, but I don't think we could have totally avoided it. I don't think we had that kind of vaccine power either to manufacture, deliver, or whatever, to cover the kind of population that is required to truly take away the disease, the way probably Israel has done or US is doing right now. So I think that is still a far-fetched thing. We have to keep trying. Ultimately, this disease will go away when most of the population either develops immunity because they got infected or because they got the vaccine. Until then, we'll have to struggle like this. My problem here is as follows. Number one, when we talk of these curfews or lockdowns now it is as Swapneil I think mentioned, these are the smaller cities. Now all these cities are getting huge surges, which didn't see it last time. So I don't know how you're going to, the cities these people mentioned, they're going back to the rural parts of those areas. But
Yeah.
Banaras, Lucknow, they're all facing huge challenges. So I don't know how they're going to manage in that with their very limited health capacity. That really scares me. I don't have a very good answer. Metros locking down is one, these small cities locking down is the other. But I do think that living into the states largely is a good idea. There is a difference. There will be a difference in healthcare. There's no question. We know there's a difference between states, and the specialists have already emphasized that point in their study. But the fact is that you still have to do it at the ground level. So I think you have to leave it to the people to figure out. I mean, you
Yeah.
can't. So, and I think what I've heard, if I'm not wrong, is the central vaccination program will continue. It said it at the bottom of that notice. So I don't know what that
Yeah.
means, whether it means it's going to continue
Yeah,
the
it's a
same
bit
way.
confusing. We need a little more details of exactly how it's going to work. The details are a bit hazy, and you could be right that maybe the centralized vaccine program works out and states additionally can procure vaccines. I don't
Probably, I
know.
hope so. I
But where
hope so.
are these vaccines? Abhishek, how would this dysfunctional federalism play out in the vaccine rollout? That's the name of your paper. Right now, they're attempting to course correct. We must acknowledge when they attempt to course correct, there's an attempted course correction saying, okay, we are empowering the states to take their own decisions on procuring vaccines, on purchasing vaccines, and everyone above 18 can go and get one from the 1st of May. I will still ask, where are the vaccines? We have met old people who could not get their scheduled second dose because there wasn't enough of the vaccine at the centers. Please unmute yourself, Abhishek.
Yeah.
Yeah.
So I think before we talk about vaccines, we first need to think about how much of money we pour into the non-pharmaceutical interventions which we are actually trying to impose. First, we need to have messaging clearly out which says, hey, this is the problem. These are the measures which one can take, and this is how we want to carry on before actually imposing a lockdown. Even a lockdown, when we think about a lockdown, and a lockdown needs to be imposed in such a manner that people can actually adjust to the new normal, which would then be, would be then reality after you impose a lockdown. So once a lockdown is imposed, people start crowding into shops and groceries, and that by itself creates a lot of super spreader events. So one needs to think about that before we talk about vaccines. And especially, so I think Shruti has been doing a study on how vaccine rollouts are happening in India. So I'll leave that to her. But what I want to say very simply is that we need to start allocating strategic budgets which are actually capable of
Yeah.
managing crises like this. We don't spend enough money. We just don't spend enough money, and we've not learned from the past events. We've
we
consistently.
we may not have even learned necessarily from 2020. We've learned some things. Thankfully, public transport was not closed. Otherwise, we would have seen the same
Yes.
scale of humanitarian crisis. Because if you see the kind of panic in the middle class and the upper middle class, you can't even begin to imagine what the panic is among the poor. And we got a sense of that from talking to those migrant workers. I need to start taking concluding comments now. Abhishek's made his. Shruti, I'll bring you in on the vaccines now, and then we'll end with the doctors. Yeah.
So I think decentralizing vaccine procurement is a great idea. I just want to add 2 points to that. Number one, the states absolutely have the money for this. The vaccine cost, to vaccinate the entire population of the state is a drop in the ocean, and it is money very, very well spent compared to the alternative, which is massive economic costs of both the pandemic and the lockdowns that, one is forced to impose. Having said that, I think the union government has a really important role, which is removing all the roadblocks in increasing vaccine manufacturing capacity and production. Right now, there's an embargo, on exports in the United States, which is severely hampering vaccine manufacturing in India right now. It's the union government's job. I mean, they are really responsible. They should pick up the phone, call the Biden administration, remove these restrictions, and make sure that in the short run, Indian manufacturers don't face these problems, right? It should remove every licensing, permit, transportation, coordination roadblock. So there is a huge role for the central government, aside from a budgetary role, right? They've just given a huge credit line to both Serum Institute and Bharat Biotech. I think these are the things that absolutely need to be done. On allocation, I think the states are best placed, both for pharmaceutical and non-pharmaceutical intervention. So both vaccine allocations, procurement, how they distribute at the local level, states are, I think, the best informed. And the non-vaccine interventions like, masking, social distancing, I think that's not even a state level job. That's a district level, your local district magistrate. That's the level at which we should be deciding if a temple is open, if a playground is open, are we allowed to have political rallies and so on and so forth. So I think that's the way we should think about it. And in a federal government, there's a very important role for all three levels. I think the question is coordination and not, pointing fingers and blame.
Yeah.
And it is a complete myth that we don't have the money for vaccines. We spend a lot of money on a lot of things. This money
we may have the money, but where are the vaccines? All the
vaccines,
of the world
the supply will be forthcoming if we allow vaccine manufacturers to set the price right and profit from it. Number one, which is very, very important. So remove the price controls. And two, remove the kind of global roadblocks which have been caused by the pandemic, which frankly require some government effort so that, global supply chains can work a little bit more smoothly.
Okay, I want to end now with both the doctors. Is there anything at all that can give us hope? Not false hope, but some hope at this point, because Swapneil and Dr. Mittal, we all know how dire it is. In fact, I've stopped taking questions from the live stream because most of them are about not being able to find a bed, not being able to find oxygen. My father is COVID positive at home, so I know exactly what they're feeling like, and I don't know what to say to them. I have nothing to say to anybody who's looking for a bed or an oxygen cylinder, because what are we going to say to them? I think what we can say to them is there any reason to believe that state by state, Maharashtra is arguing that it is peaking. Swapneil, you're in Mumbai. Do you agree with the task force assessment that the peak is over and the plateau is beginning? Just mathematically, I know we don't know for sure.
So I want to answer the core question, which is about do lockdowns work, but I'll answer this question. I think in real time, it's very difficult to know, because we don't have very good data across the board. And it's very difficult to pass out how much the interventions are working, whether we're peaking. But no, my gut feeling is no, we are not yet peaking. To answer the core question about do lockdowns work, I think we need to first define a lockdown, and then we need to define what the criteria are by which we will say that is it working or not. And we need to have the right comparison group. So it's difficult to pass out the different layers. Did the other non-pharmaceutical interventions? Let me give you an example. If we have a very pandemic-ready society like Japan and South Korea, where people follow other non-pharmaceutical interventions. They mask, they socially distance, businesses are already kind of closed, then imposing a lockdown will not have additional marginal utility. You might have very tight invasion of privacy, like they monitor where you're going based on your cell phone. In another scenario, you might have a country that is completely is not pandemic prepared, but once the pandemic hits, people will start following things. Then there you could say, yes, a lockdown would work, but so would other measures. And in the worst case scenario, you might have a country that's not pandemic ready. And even once the pandemic hits with devastating consequences, neither the leadership nor the populace follow the necessary policy measures to respond. And in that situation, you may have nothing that is effective other than a lockdown. So I think we need to define what do we mean by a lockdown, because there are several different kinds of a lockdown. B, we need to set the metrics of how do we say that, okay, it has succeeded. I would say that in our situation, we have to go with, have we been able to preserve hospital beds and have we been able to reduce mortalities? That's all we have right now. We should start to see a decrease in the R and a decrease in the number of infections in a few weeks. I think the hospitalizations and the deaths will continue even after the imposition of a lockdown.
Grim situation. Dr. Mittal, last word to you.
I think I'll just take on from where Swapneil left. Basically, if you're observing, there was a study by Bronner, a large study last year across countries. If you're willing to implement all the non-pharmaceutical measures that have been mentioned here, you probably can. Lockdown per se offers very little advantage over that. The problem is that those are not being implemented for various reasons. We can't go into that here, but at every level. So as a result, you end up with a situation that when a burst comes, you have no capacity to deal with it. Again, we really can't go through too many of these cycles, Barkha. It's going to be a disaster. So we really have to prepare ourselves for living differently, like East Asians for some time at least. And maybe they just fought it off without a single lockdown.
Yeah.
So there has to be something there to learn.
And what is that one thing? What is that one thing to learn?
The one thing is that in very crude, very basic terms, everyone has to wear a mask. Everyone has to wear a mask properly. Everyone has to make sure that we're avoiding indoor crowding. Just these two things itself will make a huge difference. Not gatherings of more than 10. If you have to meet friends, meet them outdoors, and just wear these tight masks all the time. And even now in my clinic, people, when they come into my chamber, they still take down their mask and start talking. Because somehow it's 1 year now, and it's every day. It's not like a higher proportion of them take off their masks, majority take off their masks. So it's a challenge there. And, till we get used to all this, I'm afraid we are stuck with this virus for some time.
And allow people to test themselves at home. Self-home testing. Open it up.
Yes, of course.
Yes. Open it up. That's
Empower
critical.
the people to know their infection status.
That's a great. We have to not be terrified. I've said this before. A lot of my friends got very angry with me. We have to not be terrified of the per se testing positive numbers, because if we get hysterical about those, we're going to avoid testing. States are going to avoid testing. Administrations are going to avoid testing because there'll be mass panic.
Yeah.
So I think that's a really important. Shruti, I'm closing. I can see you trying to make a sentence there.
No, absolutely. Testing actually reduces panic, because then we have information. Yeah. What increases panic is not knowing what is out there, and then you just innocuously attend an event, and then it becomes a super spreader event, and you don't know how many people out there who are positive. So I think testing, and as Swapnil mentioned, having at-home testing kits in every household right now for wide distribution, I think this is one of the most important things that we can do.
Okay,
and approving more vaccines.
Yes, leaving it there. Swapneil, Abhishek, Shruti, Dr. Mittal, earlier to Arvinder Soin. Thank you. We will continue to report from the ground in Ghaziabad today, traveling across India, covering the pandemic. There used to be a time in this country you could talk about chasing the monsoon. I feel like I've become a virus chaser, and I'm quite literally chasing this virus. But thank you very much, everybody. Stay safe. And to our audience, see you tomorrow. Thank you for watching as always. And we'll see you tomorrow from another part of the country as we travel through the COVID epicenters. Thank you and goodbye. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.